I'm going to share with you some of the best natural treatments for diabetic leg pain and how you can safely use them to get relief whether you've got pre-diabetes, type 1 diabetes or type 2 diabetes. So what causes diabetic nerve pain? Your nerves help you to experience the world around you. Hearing, sight, smell, taste and touch. Even your heartbeat and digestion are controlled by your nerves. Unfortunately, when your blood sugar is higher than it should be, this sugar becomes poisonous to your nerves in several ways. High blood sugar damages your nerves directly. When there's too much sugar inside the nerve cells, they can't use it all up and they become overwhelmed and they don't work properly. All the excess sugar also attaches itself to fat and protein in your nerves. The outer covering of your nerves is mostly fat, and when this becomes overloaded with sugar, your nerves can't send messages around the body properly. High blood sugar also damages the blood vessels that carry food to your nerves, so they're not receiving fuel and vitamins the way that they should. And what happens to you when you're hungry? You're irritable, you might snap at people around you, you might feel weak, and you can't do the work that you're supposed to do. And that's basically what's happening to your nerves. So how can you treat diabetic nerve pain? Here are some natural supplements you can take that can help you. Let's start with N-acetylcysteine. This supplement helps to reduce inflammation around the nerves, making them less irritable and less painful. NAC is a powerful antioxidant, meaning that it helps to remove harmful chemicals in the body that can damage the cells, including your nerve cells. And it also increases the level of glutathione, that's the master antioxidant, which your body produces naturally. The usual dosage is 600 to 1,200 milligrams per day, often split into 2 doses, and you can take it in powder or capsule form. NAC can cause some mild side effects like nausea, diarrhea, and headaches, and if you have asthma, sometimes N-acetylcysteine can make it worse. Next is acetyl-L-carnitine. Acetyl-L-carnitine is important for your mitochondria to work properly, and your mitochondria are like power plants inside your cells, and they need this carnitine to help to produce energy efficiently. So if you take care of your mitochondria, your nerves can function better, which can reduce pain. And the recommended dosage is 2,000 to 3,000 milligrams per day, ideally taken in divided doses with meals. You can take it in capsule or powder form. Acetyl-L-carnitine is generally safe, but it can interact with blood thinners. So make sure you talk to your doctor about taking this type of supplement with your medicines. In terms of side effects, it may cause stomach pain, nausea, and in some people it can cause restlessness. So omega-3 fatty acids, you've probably heard that they're good for your heart. Well, they're good for your nerves as well. Omega-3s help to reduce inflammation in the body. They actually strengthen the outer covering of the nerve cells, which is made of fat. You can get omega-3s from food like fatty fish, mackerel, sardines, salmon. You can also get it from walnuts, from chia seeds, and from flax seeds. If you take the supplement, aim for 1 to 3 grams per day. Omega-3s can thin your blood. So if you're already on blood thinning medicine, talk to your doctor before you take a lot of omega-3s. And some people complain about the fishy aftertaste or stomach discomfort after taking omega-3s. To avoid this, you can take the enteric coated capsules. Another supplement that you can take that can help is curcumin. Curcumin is the active ingredient that you find in turmeric. Curcumin can be effective in relieving many different types of pain, but you need a lot of curcumin to actually get that effect. And you can't get enough from just eating lots of turmeric. So you would probably have to take the supplement to get good results. Curcumin is not well absorbed in the body, so taking it with some piperine which you find in black pepper, can increase the amount that gets into your blood. Studies show that you need about 500 to 2,000 milligrams of curcumin to get good results. And curcumin can interact with blood thinners and diabetes medicines. So if you take too much, it can also cause nausea and diarrhea. Next, let's look at alpha lipoic acid, or ALA. Alpha lipoic acid is one of the best studied supplements for nerve pain. It helps to break down carbohydrates and to produce energy in the body. And if you remember, part of the problem your nerves are having is that they're not getting enough food to produce energy. ALA helps to increase the levels of other antioxidants in the body, like vitamin C and vitamin E, and it also helps to improve blood flow to nerves, which gives them more food and more oxygen. Your body actually makes alpha lipoic acid, and you can find it in every cell. But when it comes to your diet, you can find ALA in red meat, in organ meats like liver, and in brewer's yeast. You can also find it in spinach, broccoli, tomatoes, and peas. The effective doses range from 600 to 1,800 milligrams a day, which you would split and take 2 or 3 times a day. Alpha lipoic acid can lower blood sugar, so if you're taking diabetes medicine, check your blood sugar more often. And taking it with meals will also reduce the chances of having nausea or stomach pain. So next up, let's look at the B vitamins. And B vitamins are really important to keep your nerves healthy. B1 helps convert glucose into energy. B6 helps to produce the chemicals that help your nerves to send messages. And B12 helps to take care of the outer covering of your nerves. So you need all of these to reduce nerve pain and help your nerves to heal and repair. How do you take your B vitamins? Well, you can take them as B complex so that you get all the vitamins in one tablet, or you can take them individually, which is a bit more stressful. And you can get vitamin B1, that's thiamine, but it's also available as benfotiamine, which your body may be able to use better. Taking B vitamins is generally safe in terms of side effects, but taking high doses of B6 can cause numbness and tingling, and vitamin B12 may cause itching and rashes. So let's look at magnesium. Magnesium helps to stop your nerves from getting overexcited, and that overexcitement can lead to pain. It also helps to relax your muscles and reduce cramping, which is especially useful if the nerve pain is causing tension in your muscles. Studies have shown that many people with type 2 diabetes don't have enough magnesium. Magnesium supplements come in several different forms, like magnesium citrate, magnesium glycinate, magnesium threonate, magnesium oxide. There are lots of different forms. And some of the most absorbable forms of magnesium are magnesium citrate and magnesium glycinate. So those are the ones that I recommend most often. Avoid magnesium oxide if you can. It's the cheapest form of magnesium, but very little of it actually gets absorbed into your body. Most people take around 200 to 600 milligrams of magnesium per day, but that depends on how much you actually need. It's important to start with a lower dose if you're not used to taking magnesium, because too much magnesium can cause diarrhea. If you have kidney problems, you need to be careful with magnesium. If you want to get your magnesium without taking supplements, there are many foods that contain magnesium, like leafy green vegetables, legumes like beans, peas and lentils, avocados, dark chocolate, fatty fish, and nuts and seeds. Next up, let's look at coenzyme Q10, or CoQ10. CoQ10 is a powerful antioxidant. It helps the nerve cells to generate energy. And of course, your cells need energy to work. And how would you take it? The typical dosage for CoQ10 is between 100 and 300 milligrams per day. And taking it with food makes your body absorb it better. CoQ10 is available as ubiquinone and ubiquinol, but the ubiquinol tends to be absorbed better into your body. If you're taking CoQ10, you need to be careful. CoQ10 can lower your blood pressure. So if you're on medicine for hypertension, monitor your blood pressure closely. You might also like to take it in the morning because some people find that it keeps them awake at night. Next, let's look at gamma linoleic acid, or GLA. GLA is an omega-6 fatty acid found in certain plant oils. It helps by reducing inflammation in the body, which can help to relieve nerve pain. It also helps to keep the outer covering of the nerve cells healthy so they can send messages and work better. How do you take GLA? GLA is commonly found in evening primrose oil, in blackcurrant seed oil, and in borage oil. And again, if you're taking GLA, you have to be careful if you're also taking blood thinners, because GLA can increase your risk of bleeding. Let's look at capsaicin. Capsaicin is what makes your chili peppers hot. And what it does is that it blocks the signal that tells your brain that you're feeling pain. It doesn't actually do anything to the nerves directly in terms of repairing them or healing them. But after using it for a while, you may notice that you have less pain. When you're using it as a cream, you rub a small amount of cream on the sore area up to 4 times a day. Remember to wash your hands really well afterwards. You don't want to put your hands anywhere near your face or your eyes. If you're using capsaicin cream, don't put it on any cuts or on irritated skin. At first, it might feel hot and burn a little bit, but this usually goes away as you keep using it. Besides taking supplements, some people find that alternative methods like acupuncture or acupressure can help to reduce pain. Meditation, sitting quietly to focus and do some deep breathing, this can also be helpful, and it can also actually help to lower your stress levels because stress can make your pain worse. Doing regular exercise like walking or swimming can improve blood flow to your nerves and help to manage your blood sugar and keep your nerves healthy. Activities like yoga and Tai Chi are especially good because they mix that gentle, calming movement with exercise. So you're getting the best of both worlds, and it can help you to feel better overall. And these methods, they may not work right away, but when you use them with other treatments over time, they can actually make a big difference. The type of nerve damage that people complain about the most is what we call peripheral nerve damage. This affects the hands and the feet, but it's usually worse in the feet. And some of the feelings you may experience include a burning sensation, tingling, pins and needles, electric shocks, numbness or no sense of touch, being very, very sensitive to touch, feeling like you're walking on glass. And for many people, the pain is worse at night. And over time, the pain and other abnormal feelings tend to start moving upwards from the feet, higher up the body. Unfortunately, all this pain and numbness and abnormal sensations in the feet can make walking difficult and unsteady, which can lead to frequent falls, which can cause major problems as you get older, like broken bones and head injuries. The symptoms of nerve damage may also be more severe if your blood sugar is consistently very high, and also if it fluctuates a lot, like if one day your blood sugar is very high and the next it's very low and it keeps swinging up and down. It can also increase with increasing age. Also, if you have high blood pressure, if you have high cholesterol, if you've had high blood sugar for a long time, if you drink a lot of alcohol, if you smoke, and if you're very tall. All these treatments I've talked about are much more effective if you lower your blood sugar, and I'll show you step by step how to reverse diabetes naturally in the next video.